All right, hi Carla. I wanted to, even though you didn't come today, and I appreciate you letting me know about the situation with your children. I do hope they are feeling better soon. I still wanted to go over the content for today, so that way when you come next week, we can make these up pretty easily. So today we're going to be learning how to reconstitute a powder medication. We are going to learn to withdraw from an ampule. We will also learn how to do script writing for a narcotic and non-narcotic medication. And then I'm also going to introduce how to do some of the injections today. So I'm going to start with the reconstituting a powder medicine. You'll have to bear with me as I'm going to kind of try to play around the camera as well as show you everything that I can. So some of the medications that we get for injections do come as a powder. What you see here. Hold that up here for you. So it comes as a powder. And so what we want to make sure that we do is that we change that powder into a liquid so it can easily be drawn up and administered. So we do that using a sterile solution or just sterile water, and typically they're going to come together. So if they do come together in a pack like what you saw, you want to use all of the liquid, drop all of the liquid, and then administer all of that into the powder to essentially make that a liquid as well. I'm going to grab one of my needles and one of my syringes, and I'm going to put these together really quick. Okay. Now, one of the first things I like to do when I'm working with a new syringe and needle is I do what we call wetting the syringe. So really that's just pulling back on the plunger a few times to make sure it moves pretty freely for you. And because both of these have a cap on them, they are considered sterile until we open them. So we don't have to clean the top of these just yet. But for an example, this one already has its top off. And this is a multi-dose vial, so that means that we can draw multiple times from it. So every time after we take that cap off, we need to clean the top of it. Just with an alcohol prep pad. So I'm going to go ahead and take this white cap off. And the first thing I'm going to do is draw all of this up. Now, it's really hard to see. This is very small writing. But we want to get roughly 1/2 of a milliliter out of that. And I know that because on the dosing, right here, and again, I'm sorry, that is pretty blurry. It does say 0.5 milliliters is how much we should have at the end. So I'm going to pull my safety on my needle straight back, and I'm going to take the clear cap straight off from the tip, always from the tip so you don't accidentally stick yourself with the needle. While the vial is on the table, I'm going to put my needle into the vial, and then I'm going to flip my vial upside down. Now, in this case, and I'll try to show you as best as I can, the needle is actually going to be higher than the liquid. So what we want to do is pull that vial so that we can almost no longer see the needle inside of the vial, but it is still actively inside. And then we're just going to slowly pull back on our syringe, and we should see the liquid exiting the vial. And you want to do that until everybody is out of the vial. Okay, I think I've got that, so I'm going to go ahead and pull that off. Now, in a normal situation, what we would want to do at this point would be to get out any bubbles that we have. However, we're not taking this directly as an injection into a person. So right now, the air and the bubbles are okay. I'm going to go ahead and just set that down away from me so I don't accidentally stick myself or somebody else while I get this second top open. And it is a 1 full milliliter. So it's actually more than what we need, but because it has to mix with the liquid, it will end up giving us half because that liquid is going to get absorbed into some of this powder. I'm going to take this second lid off. And trying to keep the big top on. And that's not going to happen. All right. So sometimes this happens where the full cap comes off. So the full thing came off, not just that blue piece, and that's okay. We can kind of work with this. It's not going to be a big deal. But because it did that, what I'm going to do instead of flipping it upside down is I'm going to put my needle in. I'm going to start pushing in the fluid, and I'm just going to rotate that vial around. Again, set my needle off to the side. What I don't want to do right now is activate the safety because I'm not done with the needle. And then I'm going to just rotate this in my hands. Normally I would flip it upside down, but if I did that right now, I would spill everywhere, and I am not about that life today. So you want to mix this just in your hands back and forth until all of that powder is liquefied. And it should, at the end of it, look something very much like what I consider Mountain Dew that you get from Taco Bell. So I don't know why, but that Mountain Dew always looks a little bit different than everybody else's. So once you have that, we now need to finish drawing this up. So what I'm going to do is I'm going to take my needle into my vial. Now, again, normal situation, I would flip it upside down, but because of the fact that that vial top came off, I'm going to actually just keep my needle in the liquid, and I'm just going to slowly start pulling back until everybody's out of the pool. Now, the end goal was to have 1/2 milliliter, which we see right here. And I actually have a little bit more than that. So what I'm going to do, so 1/2 is right here. So what I'm going to do is I'm going to push up to that 1/2 milliliter line. Okay. Clean up my mess a little bit. And the reason that they always have extra in the tubing and in the vial is because if there is an error, then we can at least have the correct amount that we need. So this is now where we would want to activate our safety. So we do that by pressing the safety onto a hard surface until we hear it click. Just like that. And then I'm going to tap out or flick out any of my air bubbles that I have. And she is now ready to go. What I would do in this case is I would take this needle off, because this is my draw up needle, and I would place an injectable needle on, and then that one would be ready for me to administer. Now, we don't actually administer this in class, it's just for practice on learning how to do that reconstitution. So that's number 1. Let me get my garbage out of the way here. Also, these 2 vials would go into a sharps container because they are glass. This whole thing would go into a sharps container because it is glass. And then everything else that I had, including the packaging from the needles and the syringe, this is all just garbage. So I'm going to grab a garbage really quick and have that close to me while I'm doing this. So bear with me. And I'm going to grab a sharps container just so I can have easy cleanup today. Okay, so that was procedure number 1. Procedure number 2 is withdrawing from an ampule. I'm going to give all of the materials that we're going to need here out. So we've got our glass ampule, we have a filter needle, we have a syringe, and we have gauze. So this guy here is glass, and if you notice, he doesn't have sort of that nice, easy sort of twist off. With ampules, what we have to do is actually break into them. So the first thing I want to do is get any of the liquid out of the stem up top. So you just do that by giving it a good couple of flicks, and it's probably going to be really hard to see on camera, but if you see right here, grab a pen so I can try to do this. That's not going to work. Right up here, right at the stem line, there is a white line. So right here, there's that white line. That white line right here is actually where we're going to break it. It's already sort of like I don't know, I want to say like pre-cut, but not really all the way through. Now, when we finish this, we're going to end up with 2 milliliters of fluid. It does say that right there, 2 milliliters. So I'm going to set that guy off to the side, and I'm going to get my needles together. Now, I did say that we're using a filter needle, and the filter needle is a very large needle, but what it has on the inside is, in fact, like a little filter, like almost like, think about like a furnace filter or a cabin filter for your car. That's going to stop any particles that we don't want from going into our syringe going in there. So because this is glass and we have to break into it, the potential to have small pieces of glass are very high. So the filter needle actually stops those from actually going all the way into the syringe. So again, because this is a new needle and a new syringe, I want to wet my syringe. So I'm just going to pull back on my plunger a couple of times to make sure that moves pretty freely for me. And when we're finished, that's how much fluid we should have. So that is 2 milliliters right there. Okay. But I'm going to make sure my plunger is all the way to the top. And I'm going to work on breaking into the syringe or the ampule now. So what we do is we take a gauze pad and we wrap the gauze pad around the stem. And you don't have to do this very hard. So what I do is I take like my index finger and my middle finger, put those on the back side, my thumb on the front side, and I push my thumb towards my fingers just until I hear that pop. Don't worry, I do this every quarter. There we go. So now the stem is off and I leave it inside of the gauze container. And actually what I'm going to do is take that right over and put it in my sharps container, gauze and all, because we don't know how many of those glass particles are left. Now, this is the one thing that I think is really cool, and I really try to encourage students to do this when they're here on campus, and I'm going to have you do it as well. Normal reaction, if you were to flip this over, your normal thought process is it's going to spill everywhere. But it is not the case here. So what it actually has is it's like this little barrier, this little invisible barrier right where we broke it. But once we puncture the needle in, it will break that barrier. So we can't actually flip this upside down to draw from, but it's always fun to play with it that way. So again, this is a very large, thick needle. So, I mean, it's pretty thick. So we want to be very careful when we're working with this. We're going to put the needle into our ampule. Holding the needle with our dominant hand, I'm going to grab the vial with my non-dominant hand. And you notice that my non-dominant hand is really doing all of the holding right now. Needle is in the solution all the way down at the bottom. My thumb and ring finger are holding the syringe. I'm going to take my dominant hand and pull back until I see everybody exit this little vial. Okay. There we go. So now, we normally do not recap a needle, ever. But this needle does not have a safety. So we do want to make sure that we do recap this here, just so that way we don't injure ourselves or somebody else. So what I'm going to do is just take my needle, slide it into the cap until it is completely covered, and then I'm going to push the cap on until I hear it click. Okay. Now, I'm past the 2 milliliter marking. So what I'm going to do is I'm going to push back up to that 2 milliliter line. Perfect. And if I see any bubbles, I would want to flick or kind of push those out. We don't want air bubbles in there. And I will explain to you why air bubbles are a bad thing as we start to talk about injections. But that is how we would do that. And then what we would do is, again, switch this needle out because we're not going to inject with this needle. This was just a draw up needle. So we'll change this needle out, put on an injectable needle, and then we can give this injection to the patient. So again, sharps container, regular trash. All right. I'm going to grab the items for doing injections. Okay. Oh, and I just moved the camera. Give me 1 second. All right, so did it again. We are going to start our process of learning how to do injections with an intramuscular injection. Intramuscular, if you remember some of your med term, means into the muscle. So that means that we're going to go deeper into the body than some of the surface area because we want to get to muscle. So because we are doing an intramuscular injection, the needle that we're going to use is a 25 gauge, 1 inch. 25 gauge means that we're talking about how wide or how thick the needle is. So that filter needle that we used here is an 18 gauge. So it's a very thick needle. The larger the gauge number, the smaller it is. Let me repeat that. The larger the gauge number, the smaller it is. 1 inch talks about how long the needle is. So that is what we're going to use to inject with. But we also need a needle to draw up with. So you'll always have a secondary needle that you will draw up with, and then you will change it back to this needle that is already on the syringe for injection. I'm going to open up all my packages here. Now, some examples of intramuscular injections are going to be things like your flu shots, hepatitis B, hepatitis A, Tdap, influenza, COVID, and HPV, or the human papillomavirus. We typically will see these injections be anywhere from 0.5 milliliters to up to 3 milliliters. They can be as large as that. So what I'm going to start with is this needle here is my injection needle. So I'm going to take that needle off, set it off to the side, and I'm going to put my draw up needle on and wet my syringe. Okay. I do have a multi-dose vial and the cap is already off. So I need to take 1 alcohol prep pad and clean the top. So just 1 swipe across. I'm going to allow that to air dry. And one of the things that I really like to do is I draw up as much air as I'm going to give for injection. So I'm going to draw up I'm going to administer 0.5 milliliters. So I'm going to draw up that much air. And if you notice on the syringe, there are 2 lines, a top line and a bottom line. The top line of the plunger needs to be at the half line. So I'm going to put that together. Boom. That's as much air as I'm going to give for injection. Then I'm going to pull my safety straight back, clear cap off from the tip, again, so I don't stab myself accidentally. I'm going to put this into the vial while it's on a hard surface, and then I'm going to give it a flip. So I'm going to take my non-dominant hand, palm facing up. I'm going to loop my index finger and my middle finger around the base and flip. Okay. And I'm going to take my ring finger and my thumb and hold the syringe. And I'm going to take my dominant hand, push my fluid in, and then slowly start to draw back. Now, one of the things that I always encourage students to do is draw past where you need. So draw down to like the 1 or the 1.5 line, and then push back up to what you need. This just makes sure that we actually get the correct amount. And then I'm going to flip this back over and set it back onto the table. So that way I don't injure myself or somebody else. Pull the needle straight out and activate that safety. Again, take the safety onto a hard surface until you hear it click. Okay. At this point, I would want to flick out any bubbles that I see, because we do not want to administer any air pockets or air bubbles. These can actually cause a lot of issues for patients. They can create what we call aneurysms or embolisms, and they can travel to major arteries of your body, including that of your brain, which then can cause the patient to either have brain damage or cardiac damage. All right, once I've gotten all my bubbles out, I'm going to remove that needle. This is going to go into my sharps container. And I'm going to put my injectable needle back on. It is now ready to inject. So this is my cute little ham hock here. And really, this is like the upper part of your arm. So think bicep, and this is like where your elbow would be. Sorry. This is where like your elbow would be. So when we are doing this, what we first want to do is find where we're going to give this injection. So how we do that is we want to find the shoulder bone of our patient. We're going to take our pinky and put it on their shoulder bone, and then roll our 4 fingers down. At the bottom of our 4 fingers and sort of that fatty muscle area, that's where we're going to inject. So I'm going to take an alcohol prep pad. He's not going to stand. Give me a minute. I'll stand him right back up. And I'm going to go in the middle. I'm going to do a circular motion like a cinnamon roll. I'm going to go out 2 inches with my cleaning. Why I'm doing that is because I want to take any of the bacteria that was in the middle and push it to the outside, so that way the area that I'm injecting is 100% clean. I'm going to take my gauze pad and put it right up on their shoulder. I'm going to set him down for a minute. I'm going to take my little bandage, and I'm going to put that bandage, maybe, on my non-dominant hand glove on the top. So that way it is easy for me to find and grab when I'm doing this process. Now, intramuscular means very simply that we are going into the muscle. So that means we are going straight into the muscle at a 90-degree angle. So straight in. Is a really bad angle because of the wonderful light that I'm getting from outside. Let me see if I can. Straight in. Okay. So one of the things that I like to do is when I'm completing this, I take my non-dominant hand, I take and I pinch the skin up towards the sky. The reason I'm doing that is, 1, I'm telling myself this is where I'm going. But 2, I'm distracting the patient. So if they are focused on my hand pinching them, they're not focused on the needle. Okay? So now I'm going to take my safety, pull it straight back, clear cap straight off from the tip, and I'm going to hold that in my dominant hand like a dart. Dart. I'm going to take my non-dominant hand, pinch the skin up, and I'm going to come about 1/2 of an inch away from the patient's body with my needle. It's really hard to see. Let me see if I can create a backdrop here. Hold on 1 second. Hopefully that will help to block the light a little bit. So I'm going to take my non-dominant hand, pinch the skin up. I'm going to take my needle, and I'm about 1/2 of an inch away from the patient. And on the count of 3, we're going to put the whole needle in. And it's just a simple flick of the wrist. It's not winding up and coming back. It's just a simple 1, 2, 3. Once that is done, we're going to take our non-dominant hand off, and we're going to slowly push our fluid in. Okay? Then I take my non-dominant hand again, come up here, grab my gauze, cover where the needle is, pull the needle straight back out, and activate my safety on that hard surface. Then we can take our bandage off and bandage our patient. Now this guy, thankfully, does not actually bleed. So I'm going to save that bandage for the second one. Hopefully that makes sense for you. And if you have any questions, please ask me. I'm always willing to help answer any of those questions if I know about them. All right, I'm going to clean up this one really quick. I'm going to try to get all my distractions out from behind here. When you are back on campus, I will give you a multi-dose vial, this guy here, and that will be yours to keep through the remainder of the program. And so anytime we're doing an injection, you will use that liquid to draw up with. Okay. The next injection that I want to work with is what we call a subcutaneous. So I'm going to come back down here. Subcutaneous is going to need, again, a draw-up needle. It will need 2 alcohol prep pads, a gauze pad, a bandage, and then we're going to use an injectable needle. And this one, again, is a 25 gauge, 0.625 needle, or, oh, that's bad. Of all the days that my pen decides it's going to die, today is the day, huh? So 0.625 also means 5/8 of an inch, but the packaging will read 0.625. Because this is a subcutaneous needle, we are not going as deep into the muscle. So the last time we went in was 90 degrees, so straight on, boom. This one, we're not going into that muscle, we're going into the tissue layer. So we want to go at a shallower angle. So we're actually going to go in at a 45-degree angle. And remember, if it goes in at 45, it stays at 45, it comes out at 45. A lot of students will put it in at a 45 and then draw it up to a 90. And what you're doing is you're ripping all of that tissue. So we do not want that. So draw up needle, injectable needle, draw up needle, injectable needle. Whatever is typically on the syringe is the one that we're going to inject with. So again, I'm going to open up all my packaging. I'm going to do that off camera. Okay. I'm going to take this needle off of the syringe because this is my injectable needle. I'm going to set that off to the side, and I'm going to place on my draw-up needle. Also, this is a 5/8 inch of a needle, so it is, you can already kind of see it in the packaging, it is smaller. It ends right here, where our other needle ends down here. So something to think about is that as you change the injection type, the needle size or length does get smaller. I'm going to wet my syringe, and then I'm going to grab my multi-dose vial. And because it is multi-dose, the first thing I'm going to do is clean the top. So I'm going to take my alcohol, one swipe across the top, and allow that to air dry. As that is air drying, I'm going to draw up as much air as I need for injection. So some examples of injections for subcutaneous are going to be things like insulin, vitamin B12, MMR, which is your measles, mumps, and rubella, or MMRV, which is measles, mumps, rubella, and varicella. Could just be a varicella on its own. And there's one more, and my brain is literally stuck. All right, not important. Heparin. There we go. Just had to wait for it. So we're going to draw up 0.5 or half of a milliliter. Again, remembering the top line of the plunger has to go with that half line. I'm going to pull my safety straight back, needle straight off from the tip. And I'm going to go into my vial while it's still on a hard surface. Take my non-dominant hand, palm up, grab the neck of the bottle and give it a flip. I'm going to push my air in and then slowly draw back. And remember, I talked about going past where we need and then going back up to that half of a milliliter just to make sure that we do have the correct amount of fluid. Flip your vial back over onto the table and pull your needle straight out and activate your needle on a hard surface. Trying to just create that shadow that we need. All right, I'm going to get out any of my air bubbles or air pockets that I have. And then I'm going to switch my needle back to my injectable needle. And again, this one is locked safety, so I'm going to put that into the sharps container. Okay. So now we need to figure out where we are going to give this injection. So it's going to be in the arm again. So this is, and imagine it is, I just turn so you can see my, imagine that if we were to take this, so it's just like that. Okay, it's the upper part of the arm. But so this is the deltoid where we would do our intramuscular. Subcutaneous is going to be the back side of the arm. So what we do is we find that intramuscular injection spot. So we find the edge of their shoulder bone. We put our pinky on that, and then we roll those 4 fingers down. And then I'm going to put my arm or my hand out at a 90-degree angle. And once it's in that 90-degree angle, I'm going to go right here, right where my thumb and my fingers are meeting, right here. Okay, so I'm going to clean up my patient first. I'm going to take my alcohol in the middle, 2 inches out like a cinnamon roll. Put my gauze pad on their shoulder. Bandage on my hand, non-dominant hand. Okay, I'm going to bring my needle over. I'm going to pull the safety straight back, clear cap straight off. So you can already see that is a very short little needle, but we still put the entire needle into the arm. So what I'm going to do is, again, pinch the arm. I'm going to hold my needle like a dart, and I'm going to create that 45-degree angle. So 1, 2, 3. Once the needle is in, I like to come down and hold that needle either with your non-dominant hand or move it all the way off. This just kind of keeps that angle for me. And then I'm going to push their fluid in nice and slow. And I'm going to take my gauze, cover where the needle is, and come back out at that 45. And then activate my needle on a hard surface. I could then take the gauze pad away and bandage them up. All right. The last one is doing a intradermal injection. However, that one is a little harder to do on these dummy arms because the dummy arms don't have elastic skin like humans do. So we will practice that one live on people when we are meeting on campus. And if you remember, we talked about having you come week 7 and 8. So it's February 15th and February 22nd, coming to campus on Wednesdays to meet with other students, and then March 8th. So I'm going to stop this video here. This is our procedure video. I'm going to do a secondary video to help you with the math portion or the actual homework assignment for this week. So be looking for that next.